Welcome to Genus Healthcare Solution. Today we will discuss ICD guideline for pregnancy and JAD code. So first we will start with the pregnancy guideline for ICD-10-CM. So if patient is pregnant, whether she had any complication or do not have any complication, we always need to provide diagnosis related to pregnancy as principal diagnosis. Whether patient have fracture, whether have HIV, neoplasm, cancer, sepsis, whatever disease they have, we always need to provide pregnancy related complication as the principal diagnosis. Or even though if patient do not have any complication, still we need to provide uncomplicated pregnancy code as the principal diagnosis. So basically there are three categories in pregnancy. First is patient is pregnant but she do not have any complication. So in this particular scenario, we can use two codes, or we can say we can use two series codes. The first series is JAD34 series and the second series is JAD36 series. So JAD34 series is supervision of normal pregnancy. So if patient is pregnant and she is supposed to follow up with gynecologist, and if she do not have any problem, then we need to use that if JAD34 series code. If patient is pregnant and she came for antenatal screening, in that case we need to provide JAD36 series code. The second criteria is if patient is pregnant, she do not have any problem at present, but due to some past complication, she is at high risk. So there can be a multiple reason for high risk pregnancy. So even though she do not have any problem at present, but she is at high risk. So we have O09 category for this high risk. And then we have patient is pregnant and she has current complication. So there are three categories which we need to discuss, and in high risk and complication of pregnancy is always coded by O series code. Then we are also aware about whenever patient is pregnant, we always need to aware about the trimester, because all the O series codes or any pregnancy related codes based on the trimester. So there are three trimesters in the pregnancy: first trimester, second trimester and third trimester. First trimester is 0 days to less than 14 weeks. Second trimester is 14 weeks to less than 28 weeks. And third trimester is 28 weeks till delivery. So there are three trimesters. If physician did not mention trimester in medical record, then we need to count the trimester from last menstrual period. And if last menstrual period is also not available, in that case we need to query the provider. And there is one more thing, selection of trimester in inpatient cases, because if patient admitted at that time she is in second trimester and when she discharged she is in her third trimester. So trimester is based on which date service has been provided and at that particular date which trimester is going on. So if I give you the example, patient admitted on January 10 and second trimester is there, so the coding will be based on second trimester. Physician see the patient on 13 January, still second trimester, coding will be based on second trimester. Physician see patient on 18 January and it's a third trimester. Now the coding will be based on third trimester. And if patient discharged on 25 January after delivery, then we need to use delivery code or postpartum care codes. So it's a depend on which trimester patient admitted and which date of service physician provide the service and which trimester is going on that particular day. Normally we do not provide code for unspecified trimester, but if in your exam unspecified trimester is mentioned, you can provide code for that. But generally in coding we cannot use unspecified trimester code in real time coding. Then we have routine outpatient prenatal visit. So as I told you that if patient do not have any problem, then we need to provide either JAD34 series code or JAD36 series code. Next is if patient is on high risk. So as I already told you that if patient is on high risk, then we need to provide O09 series code. So if we go in the ICD book O9 series, we will able to see that there are multiple codes available. Just as I told you, that there can be elderly gravida and younger gravida. So when we will consider elderly gravida and when we will consider younger gravida. So if patient is more than 35 years of age and she is pregnant, she will be considered elderly gravida. And if she is less than 16-year-old, then she will be considered younger gravida. So both these are keep in the high risk category. So if patient age is more than 35, we will use high risk code for that. Or less than 16, we again need to provide high risk code for that service. Then if patient is pregnant and also have complication. So how we need to tackle these situation? So normally what happen that if patient have any problem in pregnancy, most of the time we need to provide two codes. One for complication, pregnancy complicated by that particular disease, and we also need to provide disease code, because most of the time what happen that the disease which we identify in pregnancy alphabetic index, pregnancy complicated by that particular disease, is not sufficient to describe the whole condition. In that case, we need to provide an additional code. So sometime we get exact code, sometime we do not get the exact code, then we need to check the organ, which organ has been affected. And if organ is not also available, then we need to check the organ system. So I will show you a couple of examples later, and then you will understand that how the things will work out. And apart from the two code, we also need to provide gestation week code. So if patient is 25 weeks pregnant, we need to provide Z3A.25 an additional code. If patient is 18 weeks pregnant, we need to provide Z3A.18 an additional code in pregnancy. Now we are going to discuss one example for pregnancy complicated by a disease. So in our example, a 45-year-old patient who is 22 weeks pregnant visit the physician for a thyroid nodule. So in this case, first code we need to provide pregnancy complicated by thyroid nodule. So we need to go in the alphabetic index, and in alphabetic index, first we will go pregnancy complicated by, then we need to search thyroid nodule. But we will not get code for thyroid nodule under the pregnancy complicated by. So next step is there any thyroid disease codes is available? This is not also the case. Then we need to check that thyroid nodule is a which system disease. So thyroid nodule is endocrine system disease. So what code we need to take? Pregnancy complicated by endocrine disorder. So this will be our principal diagnosis. As patient is 45-year-old, then we need to use an additional code, high risk pregnancy 009.512, which is elderly gravida. So as we already discussed, if patient age is more than 35 years and she is pregnant, then we need to provide elderly gravida code. Now we need to also provide thyroid nodule code, because 099.282 did not describe the thyroid diseases, the endocrine disease is thyroid nodule. So in this case, we need to provide an additional code for thyroid nodule E04.1. And another code we need to provide Z3A.22, which is for 22 weeks of gestation. If we compare this example with the patient who is not pregnant, so in that case, if patient is 45-year-old and have thyroid nodule, we only need to provide one ICD code E04.1, which is enough to claim the bill. So we can easily see that the pregnancy coding for ICD is quite difficult. Then we have outcome of delivery. So if patient is pregnant, then she also get outcome of the delivery. It can be a single live born or single stillborn. Twins, both live born, both stillborn, one live born, one stillborn. So we have a category for outcome of delivery. So we need to go outcome of delivery in alphabetic index, and then we will found ICD codes Z37 series for this. And if we see Z37-0 is for single live born, Z37-1 single stillborn, Z37.22 twins both live born, Z37.3 twins, one live born and one stillborn. So there are multiple codes available for outcome of delivery. If we see the example that vaginal delivery, single live birth. So this is only code for the single live birth, Z37.0. So other codes we need to provide separately. Then we have pre-existing condition versus condition due to pregnancy. So if patient is pregnant and before pregnancy she also have the hypertension. So we need to use O10 series as the principal diagnosis. We already discussed the hypertension code I10, I11, I12, I13 earlier. So all the guidelines remain same. The only difference is along with the O10 series code, we are not supposed to use I10 code, but we need to provide I11, I12, I13 code. And we need to also take O10 series code according to the I11, I12 and I13. So if we see in the tabular index, then we can easily check that there are separate code available for hypertensive heart disease in the O10 series, hypertensive chronic kidney disease and hypertensive heart and chronic kidney disease. So we need to provide both the guideline O10 series code and I11, I12 and I13 code. Apart from that, we need to provide chronic kidney disease, type of heart failure code separately. So now I am going to discuss one example with you. A patient is 45-year-old, 22 weeks pregnant with thyroid nodule, chronic kidney disease and hypertension. So in that case, what ICD codes we need to use? So first of all, we already discussed that if patient is pregnant and have thyroid nodule and 45 years of age, we have multiple code O99.282, O09.512, E04.1 and Z3A.22. So these code we already discussed. Now patient have CKD and hypertension. So we need to provide code O10.212. So this is for pre-existing hypertension with CKD complicating pregnancy. Okay. So pre-existing hypertension with CKD complicating pregnancy. Then we are supposed to provide hypertensive kidney disease code I12.9 and CKD stage code we also need to provide N18.9 because in this particular scenario CKD stage is not mentioned in that. So this much of codes we need to use if patient has thyroid nodule, hypertension, CKD, 45 years of age and 22 weeks of gestation. There is another example. If we say that patient is 25-year-old pregnant, 22 weeks pregnant with a thyroid nodule and hypertension. So now in that case, a patient have hypertension only but do not have the CKD. So what we need to do, we need to provide O10.012 code for hypertension because there is only hypertension mentioned, there is no heart disease or chronic kidney disease. So O10.012 is quite enough in this particular scenario. Apart from that, we need to provide code for pregnancy complicated by endocrine disorder, thyroid nodule and number of gestation week because the patient age is 25-year-old. So there is no need to provide elderly gravida code. And if the same patient is not pregnant, then we need to provide only two code, E04.1 for thyroid nodule and I10 for hypertension. Then we have fetal condition affecting maternal management. So if patient is 8 weeks pregnant and her gestation sac looks like 4 weeks pregnant, so it is small for dates. And if she is 5 months pregnant and her gestation sac looks like 9 months pregnant or 8 months pregnant, that is for large for dates. So we have a separate code for large for date and separate code for small for date, which we can easily identify in the alphabetic index. Now, if patient is pregnant and also have HIV disease, so all the guidelines will remain same for HIV. Like B20 code we need to provide, Z21 code we need to provide. Okay. But the principal diagnosis code in this particular scenario will be O98.7. So principal diagnosis will be O98 point series and followed by the either B20 or Z21. So if patient have AIDS, we need to provide B20. Patient have HIV confirmed disease, we need to provide B20. If patient is HIV positive but do not have any sign and symptom, then we need to provide Z21. So if we check an example of 45-year-old patient, 22 weeks pregnant with HIV disease and thyroid nodule. So thyroid nodule condition we are not going to discuss. So what additional code we need to provide along with that? O98.712 pregnancy complicated by HIV disease and B20 HIV disease code additionally we need to provide. And if patient is asymptomatic HIV positive, then we need to provide O98.712 and Z21. Then we have another condition, diabetes mellitus in pregnancy. So if patient has pre-existing diabetes mellitus, we need to use code O24.02, O24.3. And apart from that, we need to provide additional code of diabetes E08, E09, E10, E11 or E13. But if patient has gestational diabetes, we need to provide gestational diabetes code for O24.4 series, and there is no need to use additional code for the diabetes. So with the gestational diabetes code, we cannot use E08, E09, E10, E11 or E13 code. But if patient is on insulin, then we can provide additional code for Z79.4. Next is sepsis, septic shock in pregnancy. So if patient is pregnant and she also have sepsis, so in that particular scenario, we cannot use A41 series for sepsis during pregnancy. So we have O85 code for puerperal sepsis. So we need to provide that code for sepsis. And for microorganism, we need to provide B95, B96 series. So if I give you the example, then you will have idea that how sepsis coding can be done in pregnancy. So if patient is 45-year-old, 22 weeks pregnant, admitted with MRSA sepsis. So in this case, we need to use O85 for puerperal sepsis. Then we need to provide code for elderly gravida and MRSA infection, as we cannot use A41 series code. So we need to provide MRA infection code B95.62 and additional code Z3A.22 for 22 weeks gestation. If this patient is not pregnant, then there will be one code we need to use A41.02 for MRSA sepsis. If patient is pregnant and also using alcohol during the pregnancy, then we need to provide O99.31 code and F10 code for alcohol related condition. If patient is a smoker, then we have O99.33 and we need to provide additional code related to nicotine dependence F17. Then we have poisoning and toxic effect. So all guidelines we need to use same as we use on normal patient. The only difference is we need to use an additional code for poisoning in pregnancy. So that code is O9A.213. So O9A.213 code we need to provide additional. Again, this is second trimester code, but the main code is O9A.2. So O9A.2 series is for pregnancy complicated by poisoning, toxic effect, adverse effect. And other code we need to provide same as whatever we discussed earlier. Then we have normal delivery. So there is a code available for normal delivery which is O80. And outcome of normal delivery will be always vaginal delivery. Okay. So normal delivery, we will consider delivery as normal delivery if the baby is single live born. So outcome of the normal delivery will be single live born and normal delivery code will be O80. So I am just repeating again, we will consider delivery as normal delivery if delivery has been done via vaginal delivery and there will be a single live born. So outcome of the vaginal normal delivery will be Z37.0. Then we have peripartum and postpartum complication related to beyond the 6 weeks. So there are multiple guidelines available which need to remember. If patient has cardiomyopathy related in during the pregnancy, then we have a code O90.3 peripartum cardiomyopathy. So these are the basic guideline which we normally use in case of pregnancy. So there may be some chances that we missed some guideline. If not, there may be chances that we missed some code if we do not follow all the guidelines. Our next topic is JAD codes. So JAD codes are never used for active disease. They are assigned for factor influencing health status or any post-surgical status, or any device has been implemented in the past, or any organ has been removed in the past. For these situations, JAD code to be used. And JAD codes can be used in any healthcare setting. It can be used in nursing home, it can be used in hospital outpatient, it can be used in hospital inpatient, it can be used in physician office also. Another thing is JAD code can be used either principal diagnosis or secondary diagnosis. So it's based on the situation whether JAD code need to be used as principal diagnosis or secondary diagnosis. Some JAD codes are used as principal diagnosis only, and others are only used as secondary diagnosis. So there are multiple category of JAD codes. So the first category is contact or exposure. So the first category is contact or exposure. So if patient came into the contact of a person who has some sort of communicable disease like tuberculosis or coronavirus or any sort of communicable disease, and he went to the physician for the checkup, and he explained that he came in contact with the patient who has these kind of communicable disease. So in that case, the diagnosis will be from the contact or exposure category. So actually patient do not have that particular disease, but he came into contact or he exposed to the patient who have some other sort of diagnosis. So either we get the ICD-10 code in the contact in the alphabetic index or in the exposure section. So normally these codes start with the Z20 series. Then we have vaccination. So if a patient came to the physician office for vaccination, then ICD-10 Z23 code need to be implemented. So whatever vaccine has been given by the physician, ICD-10 code will remain the same, Z23, for each and every vaccination. Then we have status codes. So status code, we have different status, like Z21 we use for asymptomatic HIV status. Z28.3 we use under immunization status, and Z33.1 we need pregnancy incidental. So if patient have HIV disease but there is no sign and symptom, so his HIV test is positive but he do not have any sign and symptom, then we need to use Z21 code. Z28.3 we need to provide for under immunization status, and Z33.1 for pregnant state incidental. Then we have body mass index. So body mass index code we can directly search in the alphabetic index. We need to go under the body mass, and then there are multiple Z68 series codes available. So if BMI is less than 20, then the patient will be considered as underweight. 19.9 to 24.9 is the normal BMI. Overweight is 25 to 29.9, and obesity is 30 to 39.9. And if patient has BMI more than 40, then it will be considered as morbid obesity. So normally you can leave the normal BMI code, but you need to always provide underweight, overweight, obesity or morbid obesity codes for BMI. and the series will be again remain Z68 series. So if patient diagnosed with obesity, BMI of 32.5, so we need to provide E66.9 code for obesity and BMI Z68.38 for BMI. If patient diagnosed with morbid obesity and BMI of 44, then we need to provide E66.01 for morbid obesity and Z68.41 for BMI of 44. So there are multiple BMI codes available which we need to use as per the documentation provided by the physician. Then we have long-term or current use of drug therapy. So there are some medicine which we need to provide code for that if patient is taking. So insulin is one of them. So if patient is current or long-term use of insulin, then we need to provide Z79.4. And if patient is taking anticoagulant therapy, then Z79.01. And for NSAID, Z79.1. Because long-term use of the NSAID can be produce ulcers, and it can also give major impact on liver and kidney. Then we have Z89 series code for acquired absence of limb. So acquired absence of limb normally we use like below the knee amputation or above the knee amputation, and the series is Z89. And how we can search these code? First we need to go into the absence. Then in the absence we can choose the limb, and then above the knee or below the knee we will identify the code. So the two code below the knee amputation and above the knee amputation are quite important and use multiple time if they underwent the amputation. Then we have artificial opening status, Z93. So the common artificial opening are tracheostomy, which is Z93.0, gastrostomy Z93.1, ileostomy Z93.2, and colostomy Z93.3. And how we can search these code? We need to go into the artificial opening, and then under the artificial opening we can found the code tracheostomy, colostomy, ileostomy, jejunostomy, whatever the artificial opening is there. The tracheostomy normally used for respiratory system. If patient is not able to take the breath, then physician put the tracheostomy tube. And gastrostomy is for the feeding. Then we have transplanted organ and tissue like Z94 series for transplanted organ. So the common transplant organs are kidney and liver. The kidney transplant code is Z94.0 and the liver transplant code is Z94.4. Apart from that, we also have heart transplant code Z94.1, lung transplant code Z94.2, and bone marrow transplant code Z94.81. So we can easily identify these codes if we go into the status, and under the status we can find the transplant, and under the transplant we can find the organ, or you can directly check the transplant, and under the transplant you will find the organ. Then we have Z95 series. So Z95 series used for presence of cardiac and vascular implant. So normally in the cardiovascular there are a couple of things which are very frequently used. If patient is 40-45 year old or more than that, so PTCA, CABG, AICD, pacemaker, these are very common procedure which has been done once the patient cross the age of 40-45. So for the pacemaker we need to use Z95.0. For CABG we need to use Z95.1. For PTCA Z95.5. For AICD Z95.810. And for valve replacement it's the Z95.4. So these codes, if you are able to remember, it will give you a good time save. These can be a good time saving if you are able to read learn these. And as I told you that when the patient cross the 40-45 year of age, these are the frequent procedure performed. Then we have other functional device. So other functional implant, we have joint implant. So the common joint replacement is knee replacement and hip replacement, and the codes are from the Z96.65 and 64 category. Shoulder replacement and ankle replacement are not that much common, but knee replacement and hip replacements are very common procedures, and we can easily identify these codes, we need to go in the alphabetic index presence, and then we need to identify type of implant over there. Then we have Z99 series. So Z99 series we use for dependence on machine. So there are two common machine on which patient depend. One is dialysis, Z99.2, and another is ventilator dependence, Z99.11. So if patient is ESRD patient, he will be put on either kidney transplant or the dialysis. So the dialysis status is Z99.2, and if patient put on the ventilator, then we need to use Z99.11 code. Next is history. So history code we can provide for which situation? It's very important, because we cannot provide history code for chronic condition and we cannot provide history code for acute condition, because acute conditions are those conditions who can treat between 3 to 6 months maximum. Okay, so normally it's a 6 to 12 weeks period in which acute condition are treated, and chronic condition cannot be treated. It can be managed on medicine or other therapies. So for which situation we can provide the history codes. So we can use history code for cancer if cancer has been treated and there is no active treatment going on. So if patient have cancer and he either underwent the chemotherapy or radiation therapy and there is no other active treatment going on right now, so we can use history of cancer code in that case. Or patient underwent excision of the organ in the past and currently he is not on any active treatment, again in that case we can use history code. But if patient underwent, suppose, breast mastectomy and he is on anti-neoplastic treatment at present, so even the mastectomy has been done in the past, but still we need to provide breast cancer code in this scenario. We can use family history for chronic conditions such as diabetes, hypertension, heart disease, and in the family we will only consider parents and siblings. So we cannot include family history of maternal uncle, maternal aunt, paternal aunt. So these cannot be included in history. Then we have smoking history code Z87.891. We have CBA history code Z86.73. And even though we have myocardial infarction history code, which is I25.2. So I25.2 even the history code, but it came from the alphabet I series. Normally the history codes are from the Z series. Then we have screening. So if patient came for screening, we always need to provide screening diagnosis code as the principal diagnosis, especially in the mammography and colonoscopy. So we have certain specific code available for screening mammography and colonoscopy. So we can use only these codes. Even if the cancer is there, still we need to provide screening ICD code as the principal diagnosis. For mammography, it's a Z12.31. And for colonoscopy, it's Z12.11. Then we have observation, aftercare, and follow-up. So if patient came for any suspected condition, but at the time of discharge there is no evidence of that particular disease, then we need to provide observation for suspected condition code. It can be Z03 or Z04 category. Aftercare codes we need to use if patient came for treatment on the healing phase and he is visiting to the physician, then we will consider it after care. And follow up once patient fully treated and physician advised that he need to come for checkup or follow up after 6 months or 1 year. At that time we need to use follow up ICD 10CM code. Then we have donor ICD code Z52. So if any person underwent for kidney transplant or liver transplant, so there are two persons required. One is recipient and one is donor. For donor, we have a code kidney donor, we have Z52.4, and liver donor, we have Z52.6. So you can easily identify these codes just going into the alphabetic index donor and you will find these codes over there. Then we have counseling codes. So if patient came for smoking counseling or alcohol counseling or illicit drug counseling, we have direct code for these conditions. Smoking cessation counseling, we have Z71.6. Alcohol counseling, we have Z71.41. And illicit drug counseling, we have code Z71.51. Then we have routine and administrative examination. So these series start with the ZOO. So we have annual checkup, we have like well baby exam, routine general examination. Then we have eye exam, hearing exam, dental exam, pre-employment exam, school admission exam, sports participant exam, immigration medical exam. Then we have pregnancy test encounter. So there are multiple codes available for administrative examination. So either we will find these code in the administrative examination or annual examination. Then we have category Z codes that may be only principal diagnosis. So there are certain conditions which are only principal diagnosis. So Z00, Z01, Z02, then we have Z03, Z04, Z33, Z34, Z39, Z51, Z76, Z38, Z52, Z99.12. So these are some circumstances which can be only principal diagnosis. We can easily find these code in our ICD-10 guideline also. So it's all about Z codes. So today we have done two topics. One is pregnancy and one is Z codes. So both these are very important, and you need to keep all the guidelines on your fingertip. It will help you to crack in your exam, your interview, and when you will be on live case scenario, live coding, then you will also found comfortable when you have these guidelines on your fingertips. For more information about other videos or other topics, you can check our YouTube channel or check our app, or you can register on our website genushealthcaresolution.com, or you can drop message 9911593677, or you can write us on info@genushealthcaresolution.com.